Hey everyone, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com and you can email me at jason@intricateartseminars.com. We teach 4 dry needling and 3 manipulation classes and offer 3 certifications, including a long 7-course Intricate Art Manual Therapy certification. Today I just wanted to talk to everybody about the goal of cervical spine manipulation, right? So this is something that is difficult for a lot of people to conceptualize in their mind, and it's a hard thing to think about, right? So teaching dry needling is much easier than teaching manipulation, and learning dry needling is much easier than learning manipulation, right? So manipulation, to me, I played Division I ice hockey in college, so to me it seems like learning a brand new sport, like a technical brand new sport, like learning how to play golf for the first time or something like that. Manipulation is very, very challenging. It takes a lot of coordination and it just takes constant practice, right? But if you can become proficient and really excellent at manipulation, it's one of the most powerful tools that we have at our disposal in dry needling land, right? Or in physical therapy land, including dry needling. So that's why we teach dry needling and spinal manipulation, because those, in my opinion, are the 2 most powerful tools that we have to regulate the autonomic nervous system towards homeostasis. So, okay, so the goal of cervical spine manipulation is obviously to correct deviated joints and put the cervical spine in as close to neutral as we can, right? So in the cervical spine, if my hands and my forearms are the facets, right? The cervical spine facets sit at about 45 degrees. So this would be just like my cervical spine facets are right now, right? The way that the cervical spine moves, so normal cervical mechanics from C3 to C7 is side bending and rotation to the same side. So if I side bend to the right, I downslide my right facet and upslide my left facet, right? This could be any facet between C3 and C7. So let's just say, for example, this is C4-5, right? So if I side bend to the right and keep my eyes forward, C4-5 C4 is sliding downwards on C5, and C4 is sliding upwards on C5 on the left side, right? For normal cervical spine mechanics, your cervical spine is also rotating to the right. So as we side bend to the right, the spine is also rotating to the right. The only reason that we can keep our eyes level when we side bend to the right like this is because our subcranial spine, C1-2, C2 in particular, counter rotates to the left, right? So if you had a fused occiput to C2, and especially if you had fused to C3, when you side bent like this, your nose would always go down like this. So if you had C1, C2 fused, side bending would also incorporate rotation. The only reason that we can side bend and keep our eyes forwards, remember, with a normal neck, is that C1-2 counter rotates to the left, right? So C3 to C7, when you're side bending to the right, is rotating and side bending to the right. The subcranial spine C1-2 are counter rotating to the left. Okay, so for the purpose of this video, we're just going to talk about the mid-cervical spine, right? So we're going to leave out the upper cervical spine. We'll do another video on that later. Okay, so if we're talking about C4, C5, right, what I do is I go in and I palpate the spinal segments, and I want to find the transverse processes that are slid backwards. So that would be if we're talking about a right side bending deviation, right, we're looking for a right transverse process in articular pillar that has slid backwards, because we can't push through the front of the neck. There's too much stuff there, right? We got our trachea and our carotid and stuff like that. We can grab the back side of the transverse processes though very easily. So what I want to do when I'm manipulating the cervical spine is find the transverse process that's slid back. So if this is slid back, my elbow would be the back of the transverse process, and the back of my elbow would be the back side of the transverse process, right? So if it's a side bent deviation like this, what I do somehow or other is with my fingers and with my hand, as I want to pull that down slid transverse process back forwards, so C4 is now sitting directly on top of C5 like it should be and not tilted and in right rotation, right? So the way most people are taught to manipulate, and this is how a lot of chiropractors are taught to manipulate too, is if you're pushing from, if my right hand was the manipulating hand and I'm pushing from the right side, most people are taught to push straight down towards the armpit, right? Now, technically this doesn't make any sense to me because that would be pushing the cervical facets in a down lateral glide, and they don't move like that, right? You always want to move joints while you're manipulating them the way that they move naturally, especially in the cervical spine because we have a lot more neurovasculature up there, right? So if you're putting a lot of shearing force on the cervical spine when you're doing a manipulation, you're not doing it as well as you could be, right? And it's not as safe as it could be. The safest way to perform a cervical manipulation is your force hand is going to be mainly pushing or pulling up and forwards in a 45-degree angle the same way that the facets move, right? You can add a slight lateral component to induce a little bit of rotation because the spine obviously rotates, right? But the primary direction of your manipulating force through the cervical spine should be through the back side in the articular pillar. Find the segment that is downslid and pull or push the downslid portion of the vertebrae up and forwards at more or less a 45-degree angle. Again, you can add in a little bit of rotation, right? So if I was going to do this on myself, which I don't recommend, right? But just as an example, right? So you always want to do side bending and rotation to the opposite side when you're doing mid-cervical manipulations. The reason for this is, right? So if we're talking about, if this is just the right side of the C4-5 segment and I downslide to the right, that downslides C4 on C5. If I also rotate to the right, that maximally downslides C4 on C5. So if you can picture the vertebral artery going right through the transverse foramina right here, right? So the vertebral artery is going through right there, and I side bend and rotate to the side, right? So if I side bend to the right, it's going down, and I rotate to the right, it's going down more, right? That puts a big kink going through the vertebral artery because then the arteries are off kilter, so the artery's going through like that. So one of the big confusions with a lot of manipulations, especially in the cervical spine, is people talk about or think that they should be manipulating from end range and beyond. That is dangerous and should not be done, right? You never want to manipulate a joint past its normal physiologic range. It just doesn't make a whole lot of sense, right? So the reason that we do counter mechanics, so instead of side bending and rotating to the same side in the cervical spine and then doing a manipulation, that's the most dangerous way to do it, right? You want to side bend to the right, that downslides the right facet, and then by rotating to the left, you're reopposing that right C4-5 facet, which also reopposes the left C4-5 facet and all the other facets in the cervical spine. This is the point where you hear people talking about like a tissue lock or a lock of a joint before you're manipulating it. The tension that you feel is that right C4-5 facet coming into opposition with each other, right? So when I do cervical manipulations, I'm manipulating the spine from neutral. The spine is in a neutral position, even though it's not neutral on my body. Because we know how the spinal biomechanics work, we can put the spine in neutral even if my head is off to the side by doing the counter side bending and rotation. So you always want to have, for C3 to C7, when you do your manipulation, you want to have the spine in side bending and rotation to the opposite side. So that would be right side bending with left rotation or left side bending with right rotation. And when you do the manipulation, most of the direction of the force should be up and forwards at a 45-degree angle. You never want to put too much force through a cervical manipulation. You should always take the patient to pre-manipulative position and ask and see if they have any discomfort. Slight muscle tightness is okay, but you do not want to be pushing through any significant pain or tightness, right? That's just gonna, if you're pushing through muscles that are too tight, the muscles are just gonna spaz out and pull the joint back out of place anyways. So if you think the cervical spine is not mobile enough to perform proper manipulation, go and dry needle it, come back, it'll be way easier. And another thing to think about in the cervical spine is if the muscles are super duper tight and the joint facets are really compressed, when you do a manipulation, you're really putting a lot of shearing force on the joint capsules and the cartilage, right? So you always get better, more effective, more lasting, and safer manipulations if you really address the soft tissues first, loosen up all the muscles, and then move the joints in the normal physiologic positions that they move, the normal biomechanical positions, and always manipulate the cervical spine from joint neutral. Let me know if anybody has any questions about that. I know that's a little complicating stuff. I think about this stuff all the time. Again, you can check us out at intricateartseminars.com. You can get a hold of me, Jason at intricateartseminars.com. And you can also check out our blogs. I write articles every week. If you just go to our website and click on the blog tab, you'll find a whole bunch of good information there. Thanks.